Today's interconnected world, monitoring emerging infectious diseases has become more crucial than ever. With global travel and trade, a new disease can spread rapidly across continents, making early detection and response essential. In this video, we'll explore how experts track new health threats, the tools they use, and why it matters to everyone. Let's start by understanding what emerging infectious diseases are and why they pose unique challenges to public health systems worldwide. Emerging infectious diseases are illnesses caused by pathogens that have recently appeared within a population, or those whose incidence or geographic range is rapidly increasing. These can include new viruses, bacteria, or even drug-resistant strains of known diseases. Understanding what qualifies as an emerging disease helps health authorities prioritize surveillance and allocate resources effectively. Let's look at some recent examples to illustrate this concept. Over the past few decades, we've witnessed the emergence of diseases like SARS, MERS, Ebola, and most recently COVID-19. Each of these outbreaks began with a handful of cases but quickly drew global attention due to their potential to spread. These examples highlight the unpredictable nature of emerging diseases and the importance of vigilant monitoring to catch outbreaks early and prevent widespread transmission. Monitoring emerging infectious diseases isn't just about collecting data, it's about protecting communities and saving lives. Early detection allows health officials to implement control measures, inform the public, and coordinate international responses. Without effective monitoring, outbreaks can escalate quickly, overwhelming healthcare systems and causing significant social and economic disruption. Keep track of new health threats. Countries and organizations have developed global surveillance systems. These networks collect, analyze, and share information about disease outbreaks in real time. The World Health Organization's Global Outbreak Alert and Response Network is one such example, connecting experts and resources worldwide to respond quickly to emerging threats. Technology plays a vital role in disease monitoring. From advanced laboratory diagnostics to artificial intelligence that scans news reports and social media for unusual health events, modern tools help experts detect outbreaks faster than ever before. These innovations enable more accurate tracking and forecasting of disease spread, making timely intervention possible. Laboratories are the front line in identifying new pathogens. Through genetic sequencing and advanced testing, scientists can quickly determine the cause of unusual illnesses. This information is crucial for developing targeted treatments and vaccines, as well as for tracking how a disease is spreading within a community or across borders. Field epidemiologists are the detectives of the health world. They investigate outbreaks on the ground, interviewing patients, tracing contacts, and collecting samples. Their work helps pinpoint the source of an outbreak and guides public health interventions to contain it. Without their efforts, many outbreaks would go undetected for much longer. No single country can tackle emerging diseases alone. International cooperation and data sharing are essential for effective monitoring. By sharing information about new cases, genetic sequences, and treatment outcomes, countries can coordinate their responses and prevent the spread of disease across borders. Early warning systems are designed to detect unusual patterns of illness before they become major outbreaks. These systems use a combination of clinical reports, laboratory data, and even environmental monitoring to spot potential threats. The sooner a new disease is detected, the faster public health officials can act to contain it. Community-based surveillance involves training local health workers and community members to recognize and report unusual illnesses. This grassroots approach is especially important in remote or underserved areas where formal healthcare systems may be limited. By empowering communities, health officials can catch outbreaks early and respond more effectively. Many emerging infectious diseases originate in animals before jumping to humans. Monitoring animal populations for signs of illness is a key part of early detection. Veterinarians, wildlife experts, and public health officials work together to track diseases in animals and prevent them from spilling over into human populations. Environmental surveillance involves monitoring water, air, and soil for pathogens that could cause disease outbreaks. This approach can provide early warning of potential threats, especially for diseases that spread through contaminated environments. By keeping an eye on these factors, health officials can take preventive action before people get sick. Healthcare workers are often the first to notice unusual clusters of illness. Their vigilance and timely reporting are critical for early detection. Training and supporting these frontline workers ensures that new threats are recognized and reported quickly, allowing for a swift public health response. Clear and timely communication is essential during outbreaks. Public health officials must share accurate information with the public, healthcare providers, and international partners. Effective communication helps prevent panic, encourages cooperation, and ensures that people know how to protect themselves. Despite advances in technology and global cooperation, monitoring emerging diseases remains challenging. Limited resources, political barriers, and underreporting can all hinder effective surveillance. Addressing these challenges requires ongoing investment, international collaboration, and a commitment to transparency. Once a new disease is detected, rapid response is vital. This includes isolating cases, tracing contacts, and implementing control measures. The faster these steps are taken, the better the chances of containing the outbreak and minimizing its impact on society. Vaccines are one of the most effective tools for controlling infectious diseases. When a new pathogen is identified, scientists race to develop vaccines that can protect at-risk populations. Monitoring helps identify who should be vaccinated and tracks the effectiveness of immunization campaigns. Antimicrobial resistance is a growing concern in the fight against infectious diseases. Some pathogens evolve to resist treatment, making them harder to control. Monitoring resistance patterns helps guide treatment decisions and informs public health strategies to slow the spread of resistant strains. Genomic surveillance involves sequencing the genetic material of pathogens to track their evolution and spread. This powerful tool allows scientists to identify mutations, monitor transmission chains, and detect new variants that may pose additional risks. Genomic data is now a cornerstone of modern disease monitoring. Big data analytics enables health authorities to process vast amounts of information from diverse sources. By analyzing trends in real time, experts can identify outbreaks earlier and predict how diseases might spread. This data-driven approach is transforming the way we monitor and respond to emerging threats. Social media platforms and news outlets can provide early clues about emerging health threats. By monitoring online conversations and reports, public health officials can spot unusual illness patterns and rumors that may indicate an outbreak. This approach complements traditional surveillance methods and helps reach broader audiences. International health regulations, IHR, are a set of rules agreed upon by countries to prevent and respond to public health risks. These regulations require countries to report certain disease outbreaks and public health events to the World Health Organization, ensuring a coordinated global response. The World Health Organization (WHO) plays a central role in coordinating global disease monitoring and response. By providing technical support, sharing information, and mobilizing resources, WHO helps countries detect and respond to emerging infectious diseases more effectively. Travel and border health measures are important tools for preventing the spread of emerging diseases. Screening travelers, providing health information, and implementing quarantine when necessary can help stop outbreaks from crossing borders and becoming global threats. Local governments are often the first to respond to emerging health threats. Their ability to implement control measures, communicate with the public, and coordinate with national and international partners is critical for effective disease monitoring and response. Non-governmental organizations (NGOs) often play a vital role in disease monitoring, especially in areas with limited resources. They provide technical expertise, support surveillance efforts, and help deliver healthcare services during outbreaks. Education and training are essential for building strong disease monitoring systems. By training healthcare workers, laboratory staff, and community members, countries can improve their ability to detect and respond to emerging threats quickly and effectively. Public awareness campaigns help inform people about the risks of emerging diseases and how to protect themselves. These campaigns use various media channels to reach diverse audiences, promoting behaviors that reduce the spread of infection. Research is fundamental to understanding and controlling emerging infectious diseases. Scientists study how diseases spread, develop new diagnostic tools, and test treatments and vaccines. Ongoing research ensures that monitoring systems stay ahead of evolving threats. Monitoring emerging diseases raises important ethical questions such as privacy, consent, and data sharing. Balancing the need for public health protection with respect for individual rights is a constant challenge for health authorities. The public plays a crucial role in disease monitoring by reporting symptoms, following public health advice, and participating in vaccination campaigns. Community engagement strengthens surveillance efforts and helps ensure a rapid response to new threats. COVID-19 pandemic is a powerful example of the importance of monitoring emerging infectious diseases. Early detection, rapid sharing of information, and coordinated global response were all critical in managing the crisis. Lessons learned from COVID-19 continue to shape how we approach disease surveillance today. Past outbreaks from Ebola to Zika have taught us valuable lessons about the importance of preparedness, transparency, and rapid response. Each event has highlighted strengths and exposed weaknesses in global monitoring systems, driving improvements for the future. Looking ahead, advances in technology and data science will continue to transform disease monitoring. Innovations like real-time genomic surveillance, mobile health apps, and global data sharing platforms promise to make early detection even faster and more accurate. The One Health approach recognizes that human, animal, and environmental health are interconnected. By integrating surveillance across these sectors, we can better detect and respond to emerging diseases that cross species and ecosystem boundaries. Artificial intelligence is revolutionizing disease monitoring by analyzing massive datasets, identifying patterns, and predicting outbreaks. AI tools can scan news reports, social media, and health records to provide early warnings and support decision-making. Mobile health technologies such as smartphone apps and wearable devices are making it easier for people to report symptoms and receive health alerts. These tools enhance surveillance by providing real-time data from diverse populations, improving the speed and accuracy of outbreak detection. Global health security depends on strong monitoring systems that can detect and respond to threats anywhere in the world. Investments in surveillance infrastructure, workforce training, and international cooperation are essential for protecting everyone's health. Preparedness and resilience are key to managing emerging infectious diseases. By building robust monitoring systems, stockpiling essential supplies, and planning for emergencies, countries can respond more effectively when new threats arise. Sustained funding and investment are necessary to maintain and improve disease monitoring systems. Governments, international organizations, and private partners all have a role to play in supporting surveillance infrastructure and research. Trust is essential for effective disease monitoring. People are more likely to report symptoms and follow public health advice when they trust authorities. Transparent communication, community engagement, and respect for privacy help build this trust. Emerging infectious diseases are constantly evolving, and so must our monitoring systems. Flexibility, innovation, and a willingness to learn from experience are crucial for staying ahead of new health threats. Global solidarity is the foundation of effective disease monitoring. By working together, sharing resources, and supporting each other, countries can build a safer, healthier world for everyone. The fight against emerging diseases is a shared responsibility. Monitoring emerging infectious diseases is an ongoing challenge that requires vigilance, cooperation, and innovation. By investing in strong surveillance systems, embracing new technologies, and fostering global partnerships, we can detect and respond to new health threats more effectively. Together, we can build a future where emerging diseases are identified and controlled before they become global crises.